Welcome back, guys, to Wisdom and Life. It's been a minute, and for the first time on the show, we are having a discussion. We are used to having just me talking to you, but I think we are growing and we need to embrace the growth. This discussion is coming from the last video I made about your health, your responsibility, and I discovered that many people were interested, especially on my other social media handles. They were coming into my inbox and asking me if I could do more of these educative talks. Of course, I've been talking about my personal journey with breast cancer, but at some point, I feel like we need to educate one another. We need to educate each other about matters health, and that is why we are on this show. So before I forget, I want to remind you that YouTube has given us the join button to membership. You can join our membership by just clicking on that button for join and supporting. I'm hoping for the future that this channel will be able to support a cancer patient. So if you go to the community tab, you'll also see a long list of things and the vision that I'm having for this particular channel. So today, without much further ado, I want to invite the guest we are having on the show. He's a colleague and a fellow nurse, and I just want to give him an opportunity to introduce himself. Please.
Okay, thank you. Welcome, guys, to this particular noble cause. For starters, my name is Calvin's Tea. As she has mentioned, I'm a colleague. I'm a nurse by profession, and it's an honor to be on this platform, at least to be able to share the knowledge that we have with the mass out there, and also appreciate each other's effort towards at least maintaining an individual's health status and also some peace of mind that comes along with our health.
Yes.
Yeah, you're welcome.
Thank you. Thank you so much, Calvins, for coming on the show today and just starting us off. A maiden discussion indeed. And today we just want to look at what are the patient's rights. And basically, if you're watching from another country, they may be more or less the same, but we are discussing about the patient's rights in Kenya. And in Kenya, all our rights, all our laws are embedded in the Constitution 2010 of Kenya. And basically, Article 43 talks about attaining the highest health care, and both in products and in service, meaning if you are giving medication, they have to be highest care. If it's services that we are offering, it has to be attainable and highest attainable. And so the other law that we are using in Kenya is the Kenya National Patients' Rights Charter of 2013. That is what guides us when it comes to patients' health, patients' rights and responsibilities. And there are no rights without responsibilities. And you, as the patient who is watching this show today, just know, yes, you have the rights, but your right ends where the other person's right begins. For example, if the Constitution talks about freedom of speech, your right will end where there is now, you are stepping on the other person's toe, and it may be called slander or defamation, depending on what it is that you are doing. So as we discuss about the patient's rights, please know that there are responsibilities as well, so that you are not demanding what you cannot keep. It's like a bargain, a catch-22 situation, where you have what you actually demand from us and what we actually as caregivers demand from you. So let's delve into the issue at hand today. Kindly, let's just discuss some of the rights that patients have as they come to the healthcare.
Okay. I will mention the right to confidentiality. In the matters pertaining confidentiality, this is a key aspect in an individual's treatment, especially being that the patient had to just leave the comfort of his home and just go out there and try and seek services or even consultation from a different individual who is not perceived as a friend, is just a total stranger. But the trust that the patient puts in that person is whatever that will be able to ensure that this patient will feel the trust or will be broken down further.
And so, the safety.
Yeah, and the safety also.
Yes, yes.
So whenever the patient gets to at least feel welcome and be able to open up to an individual, it really creates some mutual ground so that everything can just prosper between them.
Okay, thank you, thank you. Right to confidentiality, because basically this patient has invited us into their life and we cannot go ahead. And there is a rider, if you are whatever information we are becoming confidential about is a hazard or can affect the other person's health or put the other person at risk, then by law we are permitted to break that confidentiality.
Another aspect of the patient's rights that we need also to be so keen and at least fight for it is the right to information. I find this so vital, especially being that we never know what is a patient is undergoing. So in this case, you're coming to at least get to know the information that you would want to even share with people across maybe the family or your friend circle, depending on what's ailing you. So in this case, wherever you'll visit, and let's say the health professional that you'll be able to sit down with, the individual should be able to provide you with the necessary information, and that information should at least look into aspects that are both psychological related or maybe then physically, a physical aspect, or maybe some activities that somebody is indulging in that could either aggravate or also could probably bring a relief towards a patient's concern.
And it is that information that is required for this patient to make an informed consent. So I think it's just good that, you know, we are dealing with lay people who do not have the kind of training we have had as healthcare providers. So don't just assume they know everything. Give them the information, let them choose from the information that you've given them, as long as it is not jeopardizing their management.
Yes, yeah, also to reiterate on something, with the current trends, we have so much information in the social media and also basically on the internet. So a patient will make an approach already with some basic information through the various media. But it's also good to put it on the table so that it can also help to be given the clearance. Like they can make you to understand what really is good to consume and what you should leave out, so that at least even for you to be able to be settled. Because at times you can happen to witness something or watch something and then it becomes a bit of a turmoil to also fight that thing within you. So it will be so hard for you to let it known to someone. You'll try to fight that battle, but once you get the platform in which somebody reassures you of what's really going on, you'll be at peace and you'll also open up further than even you had expected.
Yes, yes. And also, we don't need to work with the patient on assumption that they know.
Yeah, sure.
It's not common knowledge, because, you know, I can tell you that I did not consent to this. Reason being, I didn't know what I was getting into. Sometimes because of age, we just put a thumb and, you know, someone can say, no, I was not understanding clearly. And basically, even when you are giving this information, make sure that this person is in the right frame of mind, so that they are able to make a judgment that is very sober in terms of they really knew what they were getting into.
Yeah, and also making sure that they don't feel coerced to make a decision that wouldn't really go according to their plan or their way.
True. All right. Another right?
So also, I would mention the right to a second opinion in case an individual feels their demands haven't been met. By this I mean, you might be knowing from your perception whatever you're undergoing. However, you are not in that position to really make it a final. But after doing probably a first consultation or an initial consultation with someone, you feel a bit left out because you might have a strong feeling it ought to have gone this way.
Yes, yes.
So in that case, we wouldn't compel you that you have just to follow this aspect of treatment or this advice that we have given you. But you can also just go back and try and also visit other professionals. Because at least also it helps to solve the ambiguity that comes also with the treatment.
Yes,
we know sometimes errors can happen here or there, or probably someone can feel not opening up to an individual, and when they go for the second opinion, they're able to open up pretty well to the other party, and at least in that case something can be noted which will be of much importance.
Yes, and again, there is that intuitiveness that you actually feel, this one, no, this diagnosis, I don't feel comfortable about it.
So
and again, if there is some other diagnosis that you need to think through before you commence treatment, you have a right for a second opinion so that you can as well just go find out further if there are tests to be done more. So patients have a right to second opinion. Please, we don't own the patients. Just if doctors, please just understand that this patient has a right to seek medical further medical consultation with someone else, with your colleague somewhere else. It could be in the same hospital, it could be in a different hospital.
I'd like to talk about is the right to healthcare access. What do you mean by right to healthcare access? It's 2024 and there's much growth and development outside there. Hospitals are across everywhere. From the government institutions to private entities and also communal institutions. In this case, we wouldn't expect that an individual should be out there suffering because of a condition, and yet they could be a hospital at their doorstep.
Yes.
And also to load on that, I will mention that whenever a patient is presented to a facility, there are situations whereby you find an individual can be turned away because maybe a staff or a personnel might think that the condition that patient is having might not be treated in that particular facility, which is not the ideal thing. I believe when an individual makes such a move, they're supposed to be welcomed. Let the doctor who is there assess the patient. In case it's something that is escalating that needs at least a kind of equipped institution, they could always make an arrangement, being that we also have the paramedical facilities and the ambulance. They will really come in hand in such a situation.
So basically we're just saying that across all levels you must be able to access health. So this is something that was developed in 2013, and we have Devolution as we are doing this video in 2024, as my colleague has mentioned. And basically the devolution was that services are able to be devolved to the lowest of levels. That is why this access of care is dealing all the way from promotive, preventive, curative services, and rehabilitative, and even this charter talks about the reproductive health. Then he's already mentioned about emergency care. Basically, that is what he's just said, that if you come into an institution, you are not supposed to be turned away. You're not supposed to be turned away because you do not have money, especially if it's an emergency. You are supposed to be given the basic care until you are stable. Then now, the hospital or the service provider can now begin talking about money. Otherwise, it is illegal for you to be turned away in the name of you didn't have the necessary monies that you needed.
Yeah, at the mentioning of being turned away because of the various things that can come along, I've just recalled about health cover. I believe the situation of a health cover currently is a serious topic that individuals are really trying to be talked through on it, and also education being done across so that individuals can know the benefits of having a health cover.
Yes.
Because we know at times we undergo different struggles, and we never know when something will strike. So I believe with the information out there in the books and the internet, we are able at least to acquire vital information regarding the health cover. In this case, it refers to the common word, insurance.
Yes, yes, insurance.
I am insured. The moment you are insured, at least it comes with a glimpse of life, because, you know, should anything happen to me,
yes,
there's a quick response in terms of saving, and also there's a glimpse of hope with the reaction that will be taken to ensure that you remain safe.
Yes, yes.
And that your care won't be compromised because of insufficiency in funds or support. So maybe if we could get to much information maybe in the future, if the insurance companies can just be able to offer trainings so that we can be able to know what's best and at what stage should an individual take this. Those basic information can even make us have an enabling environment,
yes,
whereby we don't always keep struggling trying to collect funds and always seek help from here or there.
And again, now that brings me to the current, a bit controversial subject of about changing NHIF to SHIF.
Exactly.
You know, you've heard about public participation, and saa zingine uko tu hapo nje unapiga tu kelele, but you are not bringing in your input. You are not even getting to understand what is this SHIF thing that we are going to. What is this preventive cover that we are going to have? What is this curative cover we're going to have? What is this rehabilitative cover we are going to have? So as you talk, you have the right, yes, but get to understand. It is your right to understand what it is all about. Both the national insurance cover and even the private insurance cover. You don't just sign up for something that you are not aware. Even if you are employed, it is your right about for you to know what does that cover entail. Sometimes you go to a hospital and someone is telling you that I've come for a dental cover, yet your insurance does not have that allowance. So please get the information that you really need to get for you to be able to be served as you should. Apart from just having the insurance cover or the health information about your insurance cover, you have a right to coverage without discrimination for that particular insurance. Regardless of your age, regardless of if you are pregnant or not, regardless of, I don't know, you have a terminal illness, and sometimes even sometimes there are some insurances will discriminate you based on you having a mental disorder. What other right should we touch on?
Of course, we can't go without mentioning that. Did you know you have a right to complain regarding the treatment you get or the advice you've been given? In this case, you will refuse or complain about the treatment based on your mental capability. It's either you who will complain or another individual who in this case will treat as a next of kin. You might be a bit unconscious, or you can't make a conscious consent to grant you to proceed with the treatment. So in that case, you can just be outstanding and just say, due to this situation, I'm not willing to proceed, or due to this situation, kindly just hold it until such a time when I think I'll be in good state so that you can continue. And this one, it's not that it's just a matter of word of mouth and then you leave and go home. Of course, it has to go into document. Everything pertaining health and hospital matters, just as any other case, needs to be documented, and both parties, both the facility and the individual, and also the witness must all be involved by appending their signatures, at least so that when anything comes up later on, everyone is protected.
Yes. And then it's also your right to know the available channels of lodging a complaint. You don't just go ranting across the corridors, shouting at the healthcare persons. Remember, I told you that your right ends where the other person's right starts. So if you feel like by shouting at a nurse or at a doctor or at a caregiver, that is when your problems will be solved, then that ceases to be a right anymore. Because again, I have to protect myself. What if you beat me up? So remember, there are channels. There are actually channels that you can use in the hospital for you to make sure that your complaint is heard. It is also important to know that you have a right of response. And usually there are several procedures that allows response within a period of 12 months. So it could be verbal complaint that you are launching. It could be written complaint that you are launching. Please allow the response from the healthcare provider to come. Give it time. So that's what I wanted to mention. Another right.
Actually,
Calvo?
before we go to the other right, on that part of the right to complain, lately there's been so many incidences of uproar. Like whenever something goes against an individual's case, we tend to rush to the social media. It seems it's the greatest defender in this new generation. But I would encourage us, at least we try to walk through the right channels first before eventually now going towards that direction.
Yes, yes.
Yeah, at least it helps maintain sanity.
Yes, you are right. Another right?
Okay, another right that is, it goes almost the same to the right to complain, is the right to refuse treatment.
Yes, yes.
Yeah, it's not like it's something out of the blues to refuse treatment. It's very ideal to refuse treatment. There are so many reasons that will bring this. Number one, I would mention we have different cultural values. So the moment you realize that a course treatment is not favoring your cultural values, at that moment you can make a stop and just air your grievances, and of course it will be understood. Yes,
and it has to really be a conscious decision that you are making. One time, as I was a bedside practicing nurse, I went to give an injection to a patient, and they were having a hoodie, so they just opened up the hoodie for me to read, say no to injections. And you can imagine with your tray and the things that we've talked about, the right to information, blah blah blah, this patient was well informed, and they knew that there is an alternative route apart from just injections. They knew there is an alternative way of this condition being managed. If a condition, so you must be conscious, it must be documented, there must be an independent witness, and please make sure it is not posing danger to you or to creating an immediate danger or even a danger in future. So it's not just about right to refusal of treatment, it is a right with the right frame of knowledge and the right frame of mind. Another right that we want to mention on the show is the right to donate your organs. I know in Kenya it is something that just requires a whole show. to talk about it. And
call.
people are being buried with their organs, yet someone else should have benefited from that particular organ who is still alive. And this right to information, gather as much information as possible as to which organ you can donate in this country. You can donate your cornea, find out from your healthcare provider that which organ can I provide. And now that it is an organ that is going to be used after you have already gone, there needs to be some documentation, and there needs to be information to your relatives, so that we are not at that particular moment fighting or with the hospital that has come to take maybe a donor. You can even consent for your organs to be used for research. You can even consent, even the way you are going to be disposed. It is your right to decide while you are still alive. You can decide to be buried. You can decide to be cremated. You can decide to be preserved for research forever, that you will not be cremated, you will not be buried. So that is a right that we need to explore, and I think we will get a show on its own so that we have someone talking about it. The last right I would like us to talk about, Calvin.
Yeah, I would like to talk about the right the right to be treated with dignity and respect.
Yes, yes.
Remember, we are all humans with different professionals, cause, different hierarchy
Culture.
in the society,
Yes,
and also
yes.
the culture aspect.
Religion.
Yeah, religion, and also our beliefs as well.
Yes.
So if an individual approaches you, the manner in which they treat you should be able to echo your importance to this society.
Yes, yes, yes.
I shouldn't be able to, I shouldn't see you and the first thing I just show you like you are a nuisance, or like I just show you are not wanted here.
Yes, yes.
It's not worth.
Yes.
I should be able to welcome you, at least even tell you to have a seat and let you feel comfortable so that you can be able to open up without feeling a bit of intimidated,
like you are of no value.
Exactly.
And before you are a patient, you are a human being. And I think I've done a video in terms of giving value to yourself. Every other thing is secondary. Being a teacher, a president, a nurse, whatever title that you may be having, first of all, you are human. So we are not looking at you from your societal class or level. We are just looking at you as human. So your right to dignity and respect is very paramount. So looking at the responsibilities of the patient, because you can't just come with demands. You must also, as a patient, have your part to play, and that is what this chapter is calling responsibilities. So kindly take us through some of the responsibilities for a patient.
Thank you. To start off, I will say this first. How often has an individual ever thought about keeping up an appointment regarding anything?
Hey.
It's a bit tough, I know.
We forget sometimes.
Yeah, we tend to forget, and so many other things come in between. So in this case, number one responsibility is to keep an appointment. Yeah, remember, you will make an impact by going to the hospital and create that rapport with the staff.
Yes.
And they'll give you the care that you need. However, we also need to check on you from time to time so that we can know whatever we are doing, we are really on the right course.
Yes.
And you are at comfort and your situation is improving.
Yes.
Before any other thing. But the moment appointments are not kept, it tends to escalate into some difficult situation, especially when it comes to chronic illnesses or certain cases whereby we need to see you on short notices so that something can't go beyond our might.
Yes, yes. Saa zingine dawa imeisha, wewe unakaa tu nyumbani, ukuji ile siku uliandikiwa na daktari,
Exactly.
ugonjwa inazidi, alafu unakuja kusema hukutibiwa vizuri vile inatakana utibiwe.
Niliwatembelea lakini kazi yenu sikufurahia. Yeah, that case. Yes. And also another thing, another responsibility, maybe if we could talk about the costs. Yeah, we know costs are varying depending on the healthcare institutions and also the availability of the infrastructure generally.
Yes, yes.
So in this case, you should be able to just talk to the personnel over there regarding the financial plight you might be facing. At least they could help you figure out about the costs that you need to incur. And in most situations, the costs are usually a bit fair enough. And in case it's a bit off your grid, they usually, like the social workers, they can come in and help with that part, I believe. So,
but just know it's a responsibility to pay the bills that you have incurred in the hospital, whether by insurance or by cash. Any other responsibility?
Maybe if you could take us through one or two before.
Okay, it's okay. So it's also your responsibility to give truthful information to the healthcare provider, because we depend on the information that we get from you for us to be able to come up with the correct diagnosis, for us to be able to come up with the calculations of the dosages that we require. But if you don't give us, for example, you are a patient who has hypertension and you have not been taking your medication. You have this information with you for a while now. Yet, now when you come to the hospital, you behave like it's just the first time. So we will treat you as a newly diagnosed hypertensive patient, yet there is a doctor already managing your situation. We would love to see the documents and just see what drugs have you been on and what are you taking. Then also you have the responsibility to follow instructions regarding all the medications that you have been given and the treatment prescription that you have. It is your responsibility. In the video that I did about your health, your responsibility, hatutakuja nyumbani kukukunyia dawa jameni, si ndio? So do that part for yourself. If your treatment procedures require you to have some changes in your diet, it is your responsibility as well. If it requires you maybe to do physiotherapy, to do exercises, if you don't show up, then we have no obligation to be tied to maybe whatever it is that needs to be talked about.
Yeah, and also on that case, I will also mention you have a responsibility as an individual to know the healthcare setup within your facility. In this case, imagine a situation uko kwa nyumba, then you have a case that's disturbing you. But we can't really say that you are new to that environment or that neighborhood. But the first thing that comes to your mind is a hospital that it's maybe 50 kilometers away from you.
Imagine.
And you really insist on
going to that hospital,
that particular facility. While an individual who sees you at that particular moment thinks, I think the next door setup that we have could be of importance before we know if we really need to go the extra mile or up to the 50 kilometers. So as we walk around buying clothes and everything, just get to know even that nearest clinic beside you, know what they deal in, how often are they open,
yes,
what durations do they open, like is it a day care activity or is it a 24-hour running facility?
Yes.
Before you can hype up those establishments that are really far from your place.
Yes.
And also participate in activities that they can come with, be it like creating awareness due to particular, let's say like the World TB Day, in case they are holding such, kindly jitolee tu, tokea, interact with the people, at least you get to know people.
You know, I'm laughing because sometimes you are taking an Uber then you just get to discover kumbe this location is called so and so, and there's even a medical facility just next to you, and you're just
Exactly.
discovering on the Google map at that particular point.
Yeah,
The
sure.
last responsibility that I want to mention, we've already mentioned in the rights, but it is your responsibility if you're not happy to launch that complaint and to know the correct channels to launch that complaint. Thank you so much, Calvins, for accepting to come on the show. And I hope we will have several of these so that we can just educate the public on matters their health. And thank you so much, viewers, for really supporting this channel to grow up to where we are. Please don't just watch. If you have not subscribed, please subscribe and leave a comment, like, and share. It might help someone somewhere. Thank you for watching, and God bless you.